Hello, everyone. This is Brittany, the research coordinator for the HCU Network America. I'd like to extend a personal message of thanks to those who've enrolled in the homocystinuria data collection program powered by RareX. We recognize that you are busy and appreciate the time you take in updating surveys related to homocystinuria. So here's an update on how the program is going. We currently have 117 participants enrolled in the HCU data collection program. Here's how it looks. 78 participants have classical HCU, 39 with cobalamin disorders or severe MTHFR. But here's the part that's really important and where we need your help. Only 81 of you have completed the head-to-toe survey. That's only 69%. Without completing this survey, your data is incomplete. So please go in and complete that survey. Of the 81 participants who have taken the head-to-toe survey, here are the top 5 areas the data is pointing to. Vision being the first, brain and nervous system, digestive issues, bone, cartilage, and connective tissue, and number 5 being sleep. You may have seen a recent video about longitudinal data from one of our medical advisors, Dr. Josh Baker. Here is what it looks like within the RareX database. When you retake a survey, like this one shown here on the health and development, if you retake it, that original survey is not lost, but you add to that information, and that creates longitudinal data in RareX. So why is this data so important? Having longitudinal data and a natural history of patients helps us to study trends and allows researchers to discover cause and effect relationships and gives us an idea of the long-term impacts of homocystinuria. It leads to a better understanding of the disorder, it shortens the diagnostic odyssey, and provides better management guidelines. It also, more importantly, leads to new therapies and treatments, and ultimately our goal of finding a cure. But the biggest problem is that natural history studies are expensive. They're difficult to administer in rare diseases because we are so geographically dispersed. And so this is why the RareX platform is so incredibly important. Our goal and the ask that we have for you is to make sure that you have completed the head-to-toe survey within the RareX database. If you have completed it, please make sure that you can update it at least once a year. Even if nothing has changed, adding that information builds upon longitudinal data and provides more data points for us to be able to research. Here's a quick glimpse into some of the really great opportunities that HCU Network America has had to share the data from the RareX database. The first was a presentation I was able to give to one of our collaborating partners, CAN PKU Plus, on understanding rare disease and the importance of longitudinal data. We also had a poster presentation at their conference. And recently, I just got home from Japan, where I was able to present an oral presentation on international patient-reported data, accelerating research for homocystinuria. It was an incredible opportunity, and I could not have done it without all of your help. So please keep adding to your RareX platform and stay tuned for more updates. Thank you all.